and staffs and
Sir, GOMBE, Nigeria, and the war. The program is Good Morning. We call it Morning Show. We are lucky today, for those that are with us on the Hausa segment, knew the personnel that is in the studio. The gentleman is a physician. He said he's the staff of the World Health Organization. But to me, that word staff, maybe he's only trying to degrade his personnel, but I know even before the creation of GOMBE State, Dr. HABU DAHIRU is a don in the health sector. In fact, 1 hour program will be too small for him to explain what he wants to say, but I will not allow him to go more than 10 o'clock. Once it is 10 o'clock, we are going to wind up. Due to some of the commitments he even has waiting for him in the office. Sir, welcome to the program. Good morning, Nigeria. Good morning, GOMBE.
Thank you very much. I'm very grateful.
Mr. Dan, my usual co-presenter, welcome to the morning. Thanks for having me. My name is Ibrahim Tan. I want to be the State Media Corporation GMC-TV. I intended to start with your biography history, but no, you will not start with that, sir. Maybe the second segment, based on your discussion with the Hausa, or the Hausa segment, that will give you a second chance. Maybe during that time, I'll give you the 2 or 3 minutes to say all about yourself. But for now, I know that you are the commissioner for health, at the same time, one-time commissioner for education. So we are going to just set the ball rolling. As a commissioner of health, what are the major problems now on the ground that you have not solved now? That is my first question, sir.
Thank you very much. My background, I'm a public health physician that has worked with the United Nations, and I've always have a passion to see I prevent diseases before they occur. So now with the major outbreaks that have been occurring in Nigeria and in GOMBE State, we've had outbreak of meningitis in the early part of the year, and now we are also having an outbreak of Lassa fever. So these are my major concerns at the moment that I need to receive. Lassa fever is a very deadly disease that affects everyone, and it's common here, particularly we have almost an outbreak in the country. We had in Edo State, in Benue State, in Plateau State, in Taraba State, in Adamawa State, and Bauchi. And you see, GOMBE is strategically located. We're having borders with these states I have mentioned, particularly Adamawa, Taraba, Bauchi, and Plateau. So I'm worried. One case is an outbreak, and then we have multiple cases coming in. Then the chance of spreading across the state is quite worrisome to me. So with the confirmation of 2 cases, one case, then later on we got the second one, I declared an outbreak, and we activated the incident management system where we will do active surveillance to look out for people that are prone to or have started exhibiting symptoms, so that we can investigate them and start managing them. Then we have the management pillar, where cases that have been identified, that have been or are suspected, are isolated and managed there. Then we have the health education pillar, where we try to enlighten the public. How is Lassa transmitted? What do you do when they say you have Lassa fever? What do you do? And how do you prevent it within your environment? Then the other pillar is the laboratory pillar, where once we identify suspected persons, we take samples and take it to the laboratory for confirmation. So we have activated that, and we're doing the health education, and we're managing the cases.
So what are the causes of Lassa fever, sir?
Lassa is a viral hemorrhagic fever. It is caused by a virus that is transmitted through rats. There are marmite rats we have various species of rats. Those rats that have multiple mammary glands are the ones that typically harbor the virus. So either when you're bitten by the virus here common is not bitten by the virus, but when you keep food outside and the rats come to feed on that food, they urinate on it. In the urine of the rats, the virus is there. In the feces of the rat, likewise in their blood. So most times we have this culture of food items spread outside to dry, particularly corn or particularly grounded cassava or cassava that is being prepared to make gari. So all these things, when we spread them on the surface, on the roadside, the rats come to feed on them, and when they feed on them, they urinate on them, and you don't see them physically. So when you consume that, especially the ones that are not cooked properly or the ones that are consumed without cooking, so you get the chance of contracting the virus. So, and the major features, common signs, symptoms of it are fever, malaise, weakness, joint pains, just like malaria. So the first point of call when you come with fever, malaria, we do an RDT test and see, is it malaria? Yes, we treat you, you go. No. If it's negative for malaria and the fever is still persisting, especially when the fever is rising, I mean, we've seen cases 40 degrees, 42 degrees Celsius, which is quite high. So we now do it for typhoid. And then when you have index of suspicion, now we do listen for you to say, okay, it could be Lassa, since it is the season. So we now check you for Lassa, and once it is confirmed, then we isolate you. Once there is suspicion that it is Lassa, we isolate you because you could transfer to others, and then we do barrier nursing, we do other listen to prevent the health workers and the others that are interacting with you. Then when it is confirmed, fortunately there's some drug that we will give to reduce the viremia, to reduce the viral load of the this. Unfortunately, there's no vaccine for Lassa fever. So we have to prevent through keeping our environment clean, cooking food thoroughly, reducing the rat population around the area, either using traps or using cats to chase them away, or putting other this to kill them. So these are the ways to reduce the rat population. And commonly, most of the patients that we get, there's history of travel to an endemic area. Then there's also history, like in Gombe here, most of them went to Taraba for the dry season farming. They go for rice farming or wheat farming. And by the time they stay there, when they come back, then drivers who travel from one place to the next, when they went to Taraba, 3-4 days, come back, they come back with a fever. They went to Benue, they went to Edo. So most times there's history of travel. So when you travel, we ask you to be cautious what you eat, where you sleep, and so on and so forth.
So as a public health expert, I'm going to come to you with a very valid question. As a public health expert, I think it should be a theme of concern for you that recently America withdrew from World Health Organization. How do you think this will affect the health situation in the country generally and Gombe in particular? And then in follow-up to that, the governor recently received an award as one of the most health-friendly governors. Is that award still in validation?
Well, thank you very much. Let me start with the withdrawal of America from funding. It's not only WHO, United Nations systems and other USAID and other ones that are being supported by America. Yes, of course, it will definitely affect us because we've been coordinating and collaborating with these development partners to provide healthcare service, particularly in the areas of immunization, nutrition, all public health interventions in general. But the key is even the capacity building of our staff. The teams have been building capacity of staff locally, nationally and internationally. And it's not only Nigeria, I mean Africa, Sub-Saharan Africa in particular, are countries that will be most hit by this development. But I think it is also a wake-up call for us. We should now prioritize health, prioritize this in our budgetary position. They said as one door closed, another one opens. Obviously, if America has withdrawn, and maybe China will come, Russia will come, others will come and partner. Health is a global issue, and especially in public health. If you want to prevent people travel worldwide, so you have to, if you don't prevent the one in Nigeria, the Nigerians will travel to America and pollute America with all those things. They will travel to UK. So it's international health. And interventions must come so that we protect ourselves across the world. And I think it's not going to, we will come to a compromise with America. We will also come to a compromise with other people that will come to support. But that is a wake-up call for Nigeria, and Nigeria may have to step up there again to put in high priority in those areas and invest in those areas so that we see. We can see the federal government of Nigeria following that withdrawal. We are able to, the Mr. President and the Minister of Health and our forum of governors have all met and have agreed to enhance the budgetary provision for health and other areas of intervention. Particularly, we're now thinking of producing homegrown solutions. Particularly, we say we'll start producing vaccines, we'll start producing drugs locally that are hitherto imported into the country or with support of this. So that is a trigger for us to also have a homegrown thing. Then for the awards, the Leadership Challenge Award that Gombe State was recognized, and we got the runners-up for the Northeast. Last year, we came second as well, and we got a prize of $400,000 all in primary healthcare activities. This year, we got the same position. That one is also organized by Bill and Melinda Gates, the federal government of Nigeria, and UNICEF and other partners all put together to see if they create a competition in Nigeria on leadership and health, particularly primary health care. So we competed. There are some indicators that are there, and we got the second position. It is my hope that next year we're going to get the first position, because really, since we had first, second, 2 times. So in the next one, I hope to get the first one. So we also got the $400,000, and we're going to invest that $400,000 into the primary healthcare program so that we will further improve primary healthcare activity in Gombe State.
So if I get you correctly, you say, let's go back a little on the issue of the Lassa fever. You say the Lassa fever has no vaccine, it only has some drugs. Now, have you made research of how many people so far are contacted with the disease?
Yes, in Gombe State, across the country, like last year into this year, now Lassa fever is endemic in Nigeria, and states that have high this in Edo, Ogun, Plateau, Benue, Taraba, Adamawa, Bauchi. And now, because we share border with Bauchi, Taraba, and Adamawa, most of the patients that come in from Adamawa and Taraba, the Federal Teaching Hospital is a referral center, and people access the place for care. So, at the moment in Gombe State, we've recorded about 28 cases, suspected cases, out of which about 6 were confirmed positive, but the remaining ones were not from Gombe State. We have, when you're taking the history of a patient that comes in with the Lassa fever, when is the date of onset? If the date of onset goes back to where he came from, then the case originated from there. And it is important we know that, so that we follow up and do contact tracing of the people here. The index case has had close contact with, so that we may suspect them as well, because it's highly contagious. So we'll have to go back there, do contact tracing, identify those that have started presenting symptoms or those that have not, and monitor them and then see that we stop the spread. So about 6 cases were for Taraba State, but for Gombe State, anyway, 1 case is an outbreak. If you have 1 case of Lassa fever, it's an outbreak. So we got 3 cases in Gombe and 2 deaths. So already we're in outbreak situation. About last week, I have declared an outbreak. Since the time we got the first case, I've declared that Gombe is in outbreak situation, and I've thought for help from development partners, WHO, UNICEF, and CDC in particular.
Those countries just don't mention if they have the vaccine, they don't have it.
It's not a country. UN, there are agencies that we are working with.
Those are the questions he asked earlier.
What question is he asking?
Only the withdrawal of America. It's only America that withdrawal.
It is only America that withdrawal.
So do we have that vaccine to
It's not vaccine. We don't have vaccine to the whole world. There is no vaccine for Lassa fever.
Okay, that is the
There is no vaccine. It is being developed. Maybe research is going on. So the only way is to prevent. Then we have also a drug that when you get, we give ribavirin, and it can reduce the viral load and suppress the infection. But no vaccine at the moment. So the only way is to prevent it. And how do we prevent, like I earlier said, is reduce the rat population. Means this mammal rat with multiple mammary glands. You reduce them either using traps, using cats, using other means to clear. Then you don't spray your food on the floor, on the roadside, and then they come out to this. Then personal hygiene. Then they also barriers when a suspected case is there. You isolate the person, you take the samples, then you go. So if there are vaccine available, you take vaccine and you're comfortable. But here you have to prevent through these measures I have earlier mentioned to you.
Honorable Commissioner, sir, your administration has created a very big and conducive working environment since your inception for health workers in the state. Can you take us on a rundown from the upgrading of, let's start from Kaltungo General Hospital through to Bajoga and the upgrading of Kumo General Hospital, and how you feel about the government committing such a huge amount of finance, especially into the upgrading of Kumo General Hospital? Can you take us on a rundown?
Let's start by saying that since the electioneering time, His Excellency the Governor went around the state and saw for himself the state of dilapidation of facilities, and he promised, if elected, he's going to take care of all this. And that was why, from the stadium when he was sworn in, he drove straight to the specialist hospital Gombe. On arrival, he went around and saw the situation, and that prompted him to establish a task force. This task force, now he gave them a mandate. Give me solutions as to how I'm going to address these issues in the state. And he also combined the report of the task force and the report of the transition committee. During the transition, a committee was made and they proffered solutions to the pending problems that were at that point in time. So he immediately went into action. He identified first point of call, the specialist hospital, because there is a referral center for all the general hospitals in all the 11 LGAs. Now we renovated the model specialist hospital. The first point is the accident and emergency unit. There was just a small cubicle called A&E, and he demolished that area, built in a high-rise building with a lot of space for the A&E and offices for consultation, pharmacies, side laboratory, side pharmacy, conference room, and review offices. Then we went into the laboratory, expanded the laboratory, brought in, most of the equipment were obsolete. Most of the equipment had broken down. They went into the labor room. They expanded the labor room, provided adequate working materials, particularly for monitoring progress of labor and conduct of safe delivery. Then the wards, the theater was also expanded, and all the wards were renovated and upgraded. We also developed a molecular lab. Coincidentally, COVID came in that time. So COVID was another big challenge, and we were found a very big challenge. We had to get a place where we will diagnose this. We have to have the PCR machine. Gombe State was the first state in the country to acquire a PCR machine. And later on, we got support from the federal government and some development partners. And now we had PCR machine where we could do the test for COVID, and we were able to isolate cases, manage cases successfully, and that's why you saw the mortality in Gombe for COVID was low because of the proactiveness of His Excellency Governor, the task force he has formed. Then we went into improving the other general hospitals. We took one hospital per senatorial zone. In Gombe South, we put general hospital at Kaltungo that will serve Billiri, Shongom, Southern Balanga, and referrals from those areas can come to Kaltungo. And Kaltungo has been one of the oldest hospitals in the state. And it had the snake bite treatment unit, whereas before even Nigeria's independence, when the Sudan Interior Mission came to Gombe or to the northern part of Nigeria, they started managing snake bite. We're still getting cases of snake bites from Adamawa, Taraba, Chad, and Niger, Plateau, Bauchi, all coming to Kaltungo for management. So Kaltungo General Hospital was also upgraded. We also had the A&E and additional wards. We improved the theater, we improved the laboratory, we improved the labor room. We also provided a road network to enhance cleanliness, and we also placed the staff quarters. Then we also renovated and upgraded another unit of the hospital, which is a hospital of its own. Now we separated the snake bite treatment center from the general hospital and also enhancing. And that snake bite treatment center, we started collaborating with Ahmadu Bello University. The postgraduate students on envenomation come in to study snake bite epidemiology, management, and so on and so forth. So Gombe State University came in, Bayero University Kano came in, and we also sought for collaboration with other interested persons from the UK, Liverpool School of Tropical Medicine, and other organizations that came. Now we're doing some research. We hope to even start producing anti-snake venom. So we also will have done some research on how to manage snake bites more efficiently and effectively using. We now know the season, and we now also have to do some health education, since we know it is the time of preparing the land or time of harvesting. We are going to put in protective clothing, particularly rain boots, hand gloves, and goggles to prevent spits from. Sometimes when the snakes attack you, if it can bite you, it spreads and it can destroy your eyes if it goes into your eye. So these areas, then we now pick General Hospital in Bajoga, Gombe South. Bajoga General Hospital was also in the state of dilapidation. Now, in Gombe South, the Bajoga Hospital will take care of Kwame, some part of Kwame, some part of Duku, some part of they will all come to Bajoga. So we took that. We also made a very big accident and emergency unit. We did road network. We reactivated the staff quarters. We remodeled some of the buildings there, particularly the theater, the emergency pediatric unit, and they were not existing there before. You could see the road network that were made to enhance cleanliness within the hospital. So the staff too access road from their quarters into the hospital, and then the surrounding areas were all improved to make it climate friendly. Now whatever we're doing for the windows, we plant trees, we plant everything to make it more environmental friendly and climate friendly. And the hospital will enhance not only in the building but the equipment. If you see new equipment, beds, ultrasound machines, X-ray machines, the laboratory
services too,
laboratory equipments that will do all the tests required in the hospital were provided. So again, capacity building. The staff there, we got some new staff that were injected into the place, and we partner with particularly those from the laboratory. I remember the staff were selected from Bajoga, Kaltungo, and this was sent to other in-house in terms of laboratory support to ensure that they improve in performance at the lab. Because lab is the engineering house. Wherever we come, doctors are not magicians. They suspect, but they confirm from the lab. So you send in samples, when the samples come out and they confirm the diagnosis, and then you now start treatment. And that brings us to the upgrade of KUM. So the next hospital, or the next hospital we took, it was in total dilapidation, beyond repair. So we destroyed the whole building and clear the debris and got a virgin land to commence construction. And because we've seen there were a lot of cracks and the place was sinking, a soil testing was done by the engineers, and then they produced structures that will stand the test of time. And a new 200-bed hospital was constructed, and the model equipment supplied. It used to be just an 80-bed hospital, but now we made it to 250-bed space hospital with 12 wards, with 2 theaters, with laboratories, with expanded labor room, with immunization shade and the nutrition unit, laundry, mortuary, all these things were provided in that place. And all with a view to enhance access for patients from Gombe State.
Sir, with this capacity building of infrastructure at the same time, equipment and what have you on health issue, doctors rarely go on strike, 1, 2, and most of our doctors in Nigeria are moving out for bigger or chunk pay. Now, what are we doing towards personal capacity building, that is the doctors, at the same time, nurses and other staffs of health?
Thank you very much. You see, when this administration came into being, the first thing we did was, since the creation of Gombe State, house officers, when they graduate from indigenous of Gombe State, when they graduate from the medical school, now go outside Gombe to do their housemanship. And when we got the Federal Medical Center, then, which later became Federal Teaching Hospital, the doctors that graduate from Gombe State University and other indigenous of Gombe that graduated from either Zaria, Maiduguri, Jos, now go to the Federal Medical Center. So we felt that number, the place is chopped up. Why can't we have specialist hospital at the center? So the upgrading of specialist hospital and the equipment put in there, and then we asked all those consultants that are Gombe State origin to come back home. Some had gone to Zaria, Maiduguri, and all the rest. During residency program, they completed their program and they didn't come back. So His Excellency directed that every person should come back. Now we had consultants in 4 major areas: pediatric, O&G, surgery, and internal medicine. So that number guarantee conduct of housemanship. The accreditation came in to the specialist hospital. There was a staff quarters meant for the house officers. Then the facilities that are put in to do to provide for training, because the housemanship is still part of the training for you to become a doctor. Before you get accredited by the Nigerian Medical and Dental Council, you must do the internship to go around all these departments before you are accredited to start practice. So they came, they saw the facility, they saw the personnel, then they qualify us to start housemanship in the hospital. Not only housemanship, we now said we can also do postgraduate training. Because of the enhanced quality of care that is provided there, and the facilities that have been inputted into that place, and the infrastructure that has been provided, they came, and the accreditation team came and gave Gombe State Specialist Hospital provisional approval to start postgraduate in family medicine, postgraduate in obstetrics and gynecology, and internal medicine. So we've commenced already. young medical officers who desire to do specialty into O&G, family medicine, and internal medicine. Already,
you mean the specialists can bring up consultants about specialists to work?
Absolutely, absolutely. So this is another thing we are able to achieve. Then we look into the primary health care. Then in the primary health care, we have 114 wards. There we said, okay, we will have at least 2 level 2 hospital PHC. Level 2 means a facility that has an expanded level, has wards, lying in ward, has a side laboratory that can do basic tests, then have also 24-hour power supply using solar, then motorized borehole using solar, then staff quarters. So anytime a woman is brought, especially for delivery, there's a midwife there. The condition is every PHC must have at least 1 midwife, and it must have also a staff quarters where even if Saturday, Sunday, morning, night, you bring in a patient for delivery, there's somebody to receive the patient there. So, and the house is attached to the hospital. So each of the, at least some wards have gotten more than 2. Like Kwame, for example, there was a program under the Canadian AIDS through UNICEF. They were able to take. Then when the general, this is where 2 wards were selected, 2 facilities were selected per ward. So some have 4, some have 5, some have 10 PHCs renovated to level 2. And right now, the PHCs are providing service 24/7 with relevant staff in there, and equipment and medication. With the Go Health, you register, you choose to go to PHC or to general hospital or to a private facility. Go Health is one program that His Excellency the Governor Muhammadu Ibu initiated. It started as a pilot program from Jukera Ferry Ward, and later on Go Health was established by law through the State House of Assembly, and the infrastructure was provided. But will it be sustainable after this administration? Beyond this administration? Absolutely, because the National Health Insurance is the same thing that is being translated into the State Health Insurance, and everything established by law has come to stay. You can't repeat the law to say you abolish Go Health, and it is one singular entity that has enhanced the access to care in Gombe State, because the formal sector, the informal sector, everybody can register with a token of 12,000 naira. Yourself and 4 of your children, yourself, your wife, and 4 children can have access 24/7. All you need is to present your card on arrival, from consultation to laboratory service to medications, even surgery. You're going to get it's almost like free.
Sir, but some civil servants are complaining that most of the centers being designated by the most of them get to the hardly find drugs.
It's not true. I don't agree. We do provider forum. If there's any, we give capitation every month to every facility to buy drugs. And when that time that we did not establish GOMBE, when we established GOMBE, Drug Management Agency, and GO Farm, so drugs are available 24/7.
I think that complaint was before GO Farm.
The capitation given to, they were directed to buy drugs from Go Farmer. 1, to get the genuine drug. 2, availability and affordability, because it's going to be at a cost. Instead of you to now travel from here to Onitsha or to Lagos or to just to buy drug, you buy it in the central medical school. So the cost of transportation is reduced, and then government has deliberately also reduced it and make it available. So with that one, there is no out of stock, and people maybe are not aware. Even if it is out of stock in that facility, we have community pharmacy where we have contracted them. If it is out of stock in the general hospital, you go to the pharmacy store, present it, they will give you the same medication. And
now we are going to. And that is the information you need to continue send it so that people...
Yes, when you come to register, we tell you all this information. We tell you that when you register with us as a GoHealth beneficiary, you are entitled to get care at the service at the area you want to. If you want PHC, if you want general hospital, if you want, there are some private facilities that we have accredited. We went around and found them worthy of accreditation. So we get them accreditation that people can access. So it is, you choose where you want to go. Government didn't say you have to go to the government facility. You can go to private, you can go to PHC, you can go to general hospital. So with that, this gives you the opportunity to select where you want to go and access care. And with the complementation of the Go Farmer, the issue of out of stock is not there. And it's 24/7. And referrals, if you go to a primary health care and your condition is beyond that, they refer you. And we've tracked the referral. We ensure that what is the outcome of your referral. Were you received at the next center, and were you giving the and all the bills will go under GoHealth.
So there is one very important thing you have to clear here for the 5 years ago. Recently, the state had a fantastic health summit. We have the presence of the first lady of meeting with presence in GOMBE for 2 days.
Yes.
And the School of Nursing and Midwifery was officially commissioned and opened a very fantastic summit which he plays governor. But there's something concerning the School of Nursing that I really have been controversial that I wanted to clear. Way back, what students of School of Nursing and Midwifery are being given certain stipend or place of certain allowance or some privileges as long as they're student of that school. But of Susan, there are rumors that those privileges will exist from being. What do you have to say about that?
Thank you very much. Well, let me start with the summit. The summit was conceived by His Excellency the Governor. The idea was for us to see what we have achieved, what are our challenges, and how can you, what solutions will be provided from the summit to improve healthcare delivery in Gombe State. So we invited all the gurus of health in Nigeria and beyond. We were on air, online, across the globe. The United Nations system were involved. And we remember even the UN Secretary General made comments through the summit, and the Minister of Health, and all development partners, and all those major key stakeholders of health in Nigeria were invited, and they came around to share with us. Presentations were made and solutions, and the communique came out, very robust communique that will improve healthcare in Gombe. The summit identified challenges, identified solutions, and also identified successes that were made in Gombe. And during the period too, it was then when His Excellency announced the salary structure for health workers, the commerce and governments, and that has motivated and boosted morale of health workers. Hitherto, a doctor or a nurse in the state service is not getting the same salary as the one in the federal teaching hospital. So people were moving out of the service of Gombe State to greener pastures, either within the state, to the federal teaching hospital, or outside the state, or even outside the country. But now with the new salary structure, they're all coming back, and new younger ones are coming in to join the service. Now, Remi Tunubu, when she came, she presided over she commissioned the Federal Medical Center, Kumo. But you recall I told you the hospital was built by Gombe State, equipped by Gombe State, and then handed over to the federal government because it was so much for us to manage. And with the fact that Gombe State needed a federal medical center. You remember the federal medical center was upgraded to a federal teaching hospital. So we still had a slot. So His Excellency, in his magnanimity and proactiveness, and he went and initiated and discussed with the president and requested that the federal the general hospital of Kumo be taken over by the federal government, so that we will have more staff enrolled, recruited, and more services provided at tertiary level. Now, referrals from secondary facilities were overloading the federal teaching hospital. So when we have the federal medical center with another specialty and tertiary care, that will enhance the quality of care we have in Gombe State.
Doctor,
I'm going to talk about the bonding system. Allow me to talk about the bonding system.
Okay, maybe just a minute, please, sir. Just streamline it, please.
The bonding system, when we came in Gombe State, there were shortages of some personnel, particularly in health. Because when we came from Gombe State, I think the total number of doctors were 50 in Gombe, both private and public. So we needed more doctors. So we had a bonding system. We said anybody who wants to read medicine will place you on a salary, but on completion you're already our staff, we only post you. So we started the bonding system. But we said that when you come back, you're going to serve the state for a period of time before you go anywhere. So that's the bonding. But when people they abuse the situation, they never come back. They started running.
That's where the gap came.
No. It is not for those in the School of Nursing, midwifery, pharmacy, dental, all the areas that we had shortage of personnel. It was an incentive to encourage people to come and read those courses so that we will get personnel and fill in the gap. So at a certain time we got enough numbers that we wanted, but we still continued. But people started not honoring this. So we now said, okay, even now we are just reviewing it. We want to make it now a law. We take it to the House of Assembly. The bond, it was a gentleman agreement. Yes. That is why people, when they go, you cannot take them to court and you cannot prosecute them. But now when we take it to the Assembly and it becomes a law, we will give you a bond. We give you incentive, you go, but you will not go away on completion until you serve your bond. Then you can go.
Okay.
But now with the commerce and commerce, even the salary has improved. I think everybody is at nobody will be going away. People are even attracted. They are coming down to listen. I want to do recruitment soon. Because it's like the healthcare delivery is not about structures alone or building this. So we are going to do recruitment to put in more personnel into the structures we have provided.
Commissioner for Health, my last question in 30 seconds. You have been a politician for long. Yes. How about if the present governor anointed you as his next carry on with the affairs of the decision?
So I wouldn't know. I'm only giving service to I'm only giving service to my community and to my state and to the country at large. It is his discretion. I won't be able to say that, and I'm not going to listen. It's the people that will see the potential and the capacity in you and make such everything. It's difficult for me to say yes or no. And I'm only giving service. I was working with the United Nations system, and His Excellency invited me to come and work with him, and I'm very grateful for giving me that opportunity. And I am able to use my experience, my exposure, listen to impact meaningfully in the area of health and education, where His Excellency gave me the privilege to serve. And I thank you so immensely for that.
That is Dr. HABU DAHIRU for you. If you allow him, in fact, you will continue. Thank God the Hausa segment said that is the face of our interview. Subsequently, due to his time, if the opportunity, we will still bring him to the studio because we haven't exhausted our custom program for this particular discussion. But we are glad for our presence, and we believe that our viewers have learned 3-4 of what you have said. Thank you. So as we go back to the office to continue our services to humanity, we believe that you will continue doing your best so that you are rewarded.
Like I said earlier,
Doctor, your time is
we have not
your time is
I have not talked about God. Don't worry, talk about God now. We will talk about
we will talk about Mr. Dan, thank you very much for that. Control. Yes, I can see plenty of directors here and technicians at the same time, cameramen and what have you. God bless you for being with us on this program. For those that have watched, continue to enjoy the program coming away from Gombe State Media Corporation GMC-TV. My name is Ibrahim Tao.